नमस्कार. प्रुडेंट मिडियाच्या हॅलो दोतर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां येवकार दितना आज आमचे तज्ञ दोतर आसा तांकां हांव मना काळजासान येवकार दिता, कारण ते फक्त गोंयकार अशे न्हय तर गोंयचे डॉक्टर मार्टर हॉस्पिटल मकाय ऑस्ट्रेलिया हांगा कन्सल्टंट इन ऑब्स्टेट्रिक्स एंड गायनेकोलॉजी म्हणजे बायलां रोग आनी प्रसूतीशास्त्र विभागांतल्यो एक तज्ञ म्हणून ते काम करतात ऑस्ट्रेलिया. आनी आमकां खूब खोस आसा की गोंयची डॉक्टर येदा व्हडल्या पदार पावल्या. फक्त व्हडल्या पदार पावल्या अशें न्हय तर शी इज ऑल्सो असोसिएटेड विथ द लेटेस्ट टॅक्निक्स इन गायनेकोलॉजी आनी त्यो म्हणजे रोबोटिक सर्जरी. आज जगान जर नवें कितें जातालें ते रोबोटिक सर्जरी. तर रोबोटिक सर्जरी म्हणजे कितें, ते कशा पद्दतीन काम करता, खंयच्या विशयांनी आमकां ताचो फायदो जावं शकता, हाचो आज एडवांटेज म्हणजे फायदो कितें आसा आनी हाचो फुडार कितें, हाचे विस्कटावन चर्चा करपा खातीर डॉक्टर सॅली आज आमचे बरोबर आसा. डॉक्टर सॅली रॉड्रिग्स. दोतोर नमस्कार आनी येवकार. सगळ्यात पयलीं हांव तुमचें कौतुक करता की आमकां खूब बरें दिसता की आमचे गोंयचे मनीस आज ऑस्ट्रेलियाक येदे व्हडल्या पदार पावल्या आनी यू आर एज अ कन्सल्टंट यू आर वर्किंग. खूब बरें दिसता आनी तुमी मुजरत वेळ करून आमच्या स्टुडियोन आयली की आमच्या ह्या स्टुडियोंतल्या आमचो जो हॅलो दोतर कार्यावळ आसा तातूंत वांटेकरी जावन थोडीशी माहिती आमच्या लोकांक मेळची म्हणून तुमचो एक प्रामाणीक प्रयत्न, त्या खातीर म्हाका काळजांतसान देव बरें करूं. डॉक्टर, जेन्ना आमी रोबोटिक सर्जरी म्हणटा तेन्ना सगळ्यात पयलीं लोकांचो एक सर्वसामान्य मनशाचो म्हणजे म्हाका पयलीं अशें दिसतालें की रोबोटिक म्हणजे रोबोट सर्जरी करतलो अशें काय कितें. तर बेसिकली एज अ फंडामेंटल म्हणून वॉट इज रोबोटिक सर्जरी हाचें मातशें आमकां विस्कटून सांगात.
हय, बरोबर तुमचे. वेन वी टॉक अबाउट रोबोटिक सर्जरी, पीपल थिंक की रोबोट असो कोण तरी येता आनी म्हजेर ऑपरेट करतलो अशें 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 ताचे दे थिंक अबाउट इट लायक दॅट. बट दॅट इज नॉट द केस. What we are doing is we are basically doing the same laparoscopic surgery, but we are having technology. Medical technology is helping us do this surgery, what we will normally do, a lot better. So it improves the precision, it improves the visualization, it improves the anatomy that we can see when we are doing surgery. So as you know, nowadays medical technology has advanced a lot, and it's also in the process that is advancing and getting better and better. So robotic surgery is one of these medical advances that in medical technology that we are using to help not just us but to help patient outcomes as well. So that is where robotic surgery or artificial intelligence is helping us improve the delivery of healthcare today. So तुवें म्हणलें एक कितें robot, it is not. It is basically the platform that we use is just like laparoscopic surgery. The thing that we do is we have a central console that helps us manipulate the instruments that we use. It's all under our control. And the best thing is it improves visualization. So the difference between robotics, laparoscopic surgery as opposed to a routine laparoscopic surgery is the 3D visualization. We can assess the depth. Whereas with laparoscopic surgery is just 2D. It's like a plain canvas. With robotic surgery is the 3D. So that helps a great deal with endometriotic surgery, cancer surgery, or a massive multifibroid uterus, so massive pathology, extensive disease process help. And especially in gynecology, we find that with endometriosis, where there's lots of scarring, where major organs are involved with endometriosis, it helps us define the planes, defines the limits of the disease, and therefore improves the precision, improves the treatment, and in the long run improves patient outcomes as well. So
बेसिकली आमी जशें समजताले की हांव केन्ना खूब फावटी म्हणटा की पयलीं असो काळ आशिल्लो की बिगर द सर्जन बिगर इज द इन्सिजन. आज टायम बदलला. आज बिगर इज द सर्जन स्मॉलर इज द इन्सिजन. की आज की होल सर्जरी आयल्या, लॅप्रोस्कोपिक सर्जरी आयल्या. जशें डॉक्टरान सांगा की लॅप्रोस्कोपिक सर्जरीचो एक एडवान्स फॉर्मुला एक एडवान्स जे जर फॉर्मेट जर आमी पळयतले जाल्यार रोबोटिक सर्जरी. रोबोटिक सर्जरी म्हणजे रोबो येवन ते करता अशें न्हय, तर तूं ताचो असिस्टन्स घेवन सगळें म्हणजे आर्टिफिशियल इंटेलिजन्स वापरून हाचो एक एडवांटेज तांणी सांगला की तो म्हणजे आमी जे युजली पळयता लॅप्रोस्कोपिक सर्जरी करतना जी आज ट्रेडिशनल आशिल्ली तातूंत ही 2 डायमेन्शनल विजन म्हणजे आमी जशें टीव्हीचेर चित्र पळयता तशें हातूंत एक 3 डायमेन्शनल विजन मेळटा. मागीर तुजें एक्झॅक्टली डेप्थ कितें म्हणजे ताची खोलाय कितें आसा, ताचो टेक्स्चर कसो आसा, हें सगळें आमकां एक जाणविकाय मेळटा. सो द परफॉर्मन्स ऑफ द सर्जन इज बेटर वीच हेल्प्स द आउटकम ऑफ द पेशंट. बरोबर डॉक्टर, जेन्ना आमी हाचो म्हणटा की ओके इज दीस ऑलवेज म्हणजे वेन यू विल ऑप्ट फॉर दीस. तुमकां जर फाल्यां विचारलें की आतां अशे केसी आसा की तुमकां खंयच्या केसींनी तुमी तुमकां ऑप्शन दिला की जनरल तुमचो रुटीन लॅप्रोस्कोप आसा आनी रोबोटिक सर्जरीचो लॅप्रोस्कोप आसा. विच वन यू वील टेक फॉर विच केसीस?
That's a good question, Dhanand, because today we are looking at the future. In the future, it looks like robotic surgery will do all routine cases because it's going to be so much more affordable, safer, and better outcomes. So why wouldn't you choose for using the robot for all routine procedures as well? But at the moment, because of the costs, because of the time constraints and other things, people are using it for more complex procedures because they have found that the outcomes for both patients as well as the surgeon is a lot better. You know that with complex procedures, if we are sitting there operating, standing on our feet all day, and tiredness does come in with routine laparoscopic procedures, especially when there is extensive disease involved, when there's extensive dissection of the tissues to get to the disease to make sure that the whole disease is removed, it takes a lot longer. So fatigue sets in, not only with the surgeon, but with the staff around who's assisting the surgeon, who's helping, longer anesthetic duration, so affecting the outcome post-operatively for the women. Whereas with robotic surgery, it's all in the hub, in the console, which controls everything. So you're sitting there operating, your movements are precise. So when we are taking a stitch, we do this. But down there in the pelvic cavity, it's very fine movement. So the best thing is improvement in the fine motor skills. So the precision, the less trauma to the delicate tissues around, especially the entrapment of nerves and damage to blood vessels is a lot less. So outcomes are much better.
So in short, this is something like the crane. Like see, जो मनीस क्रेनीन बसता आणि तो सगळे ऑपरेट करता की ते व्हडले त्याचे ते हे देवयता, बकेट देवयता, सामान उखलता, मुवमेंट करता त्या टायपचे. So basically you are doing finer movements that he also has a precision. म्हणजे ताका ते व्हडले दिसता. So you have got better access.
Yes.
Correct? So basically, doctor, you have mentioned about some of the conditions, but may I ask you one question? Like, if in case of some malignancies, is it helpful? And in case, which malignancies and why?
Yeah,
or how?
It is being, in fact, it was being used, it is being used widely for oncology and cancer surgery because we can, because of the depth and the vision, you can see where, how much of the tissues are involved with cancer. So you can take just that out without damaging the surrounding structures. We are using now imaging, better imaging modalities. So we know pre-op itself how extensive our surgery is going to be. But when we get in there, we might be faced with different things. So we know the biggest advantage is the depth, how much it's how much the disease process has involved and infiltrated into the surrounding tissues. So that helps in improving that. Even with benign conditions, not just cancer, say there's a big ovarian cyst, like endometriosis involving the ovary, and the girl is looking at fertility preservation. So we know we can preserve the ovary by just preserving normal healthy tissue as much as we can. Also endometriosis, it does affect fertility. So we are not causing too much damage. We are just removing the disease process to help improve outcomes. That is the biggest game changer, I will say, in gynecological surgery today.
सो जी तरणी भुरगीं आसता म्हणजे यंग जे गर्ल्स असतात जांकां प्रेग्नन्सी येवपाची आसता आनी अशा वेळार जर तांकां एखाद्या वर्सा ओवेरियन सिस्ट जालो म्हणजे तात्याच्या हाचो जर सिस्ट जालो जाल्यार तो तितकोच काडपाक ताचो उपयोग जावं शकता. सो इट इज व्हेरी प्रिसायज. सो यू डोंट टू रिमूव एवरीथींग. सो म्हणजे अशें समजा की एका गांवांत एक चोर आयला जाल्यार आमी आख्ख्या गांवाचेरच बॉम्ब घालनासतना खंयच्या घरांत तो आसा, कोणागेर तो रावला, ताका प्रिसायजली आमी लोकेट करून ताका काडूं शकता. इट इज समथींग लायक दॅट. बरोबर? सो ह्या पद्दतीन जेन्ना आमी हँडल करता म्हणजे मेडिकल केसीस किंवा कंडिशन, त्याचो पेशंटाकूय फायदो जाता आनी जशें डॉक्टरान सांगलां की दे आर ऑल्सो इन अ कम्फर्ट झोन की बाबा हें सगळें करतना बाबा चड म्हणजे मारामारी थंय हें कर तें कर अशें मॅच जायनासतना इट इज व्हेरी क्लीन, व्हेरी म्हणजे सामकें सुपर फायन ऑपरेटीव प्रोसिजर आसता तो जाता. पेशंटाचो खूब फायदो जाता कारण देट इज लेस ट्रॉमा टू द ऑर्गन्स इनसायड. जशी नर्व्स आसा, ब्लड वेसल आसा, हांकां कमी मार बसता. आनी आज जर ही कंडिशन आज म्हणजे कितें आसा त्यो ऑस्ट्रेलियाक आसा थंय हें मातशें कॉमन आसा म्हणजे रोबोटीक सर्जरी. इंडियन अजून तितकी कॉमन जावना, पण हळूहळू आमचो एक विचार आसा आनी आमचे भलायकी मंत्री जे आसा तांणी एक विचार मांडला की रोखडे कांय दिसा भितर ही सर्जरी गोंयांतूय उपलब्ध जातली, गोवा मेडिकल कॉलेज सारक्या सेंटरान. म्हणजे हें व्हिजन घेवन आज अशे जे लोक आसात ते काम करतात. पण आज हाचो जो फायदो आसा तो बऱ्याचशा अंशी पेशंटाक जाता, रुग्णाक जाता आनी त्या खातीर हें खूब म्हत्वाचें आसा. आणि डॉक्टर म्हाका जेन्ना म्हणटा की वॉट अबाउट फायब्रॉइड, की वॉट इज युअर म्हणजे कारण फायब्रॉइड इज व्हेरी कॉमन थिंग. सो दॅट्स वाय आय एम इन रेफरन्स टू द फायब्रॉइड. हाऊ यू विल मॅनेज दीस पेशंट?
So fibroids, usually when we encounter fibroids, there's more than one fibroid involving the uterus.
Correct.
Third astat, ek, don, teen. And not all fibroids you might be able to see on ultrasound. So people are using other modalities, MRI. But when we go in there, we might find two fibroids sitting close to one another, you know, and we have to take. So what is also important is not just removing the fibroids to reduce the whole size of the uterus, but avoiding the inner cavity of the uterus, the endometrium, where the uterine cavity, where the baby is supposed to grow in there. So we try to avoid damage to that. So this helps us being very, very precise. I think precision, visualization, reducing bleeding and trauma is probably the biggest advantages of robotic surgery over routine laparoscopic or even open surgery. Open surgery, we all know now, the recovery is longer, the bleeding is more, the risks of infections are higher as well. So definitely there's a role. And you did say that the future lies in implementing or getting this technology in all areas of the world. So not just the bigger cities, but even the remote areas. Now, the biggest advantage of robotic surgery and artificial intelligence is someone is operating in a remote village where there is no super specialized surgeon and they encounter difficulties. Someone sitting in Bombay or Delhi or even in New York or London can look into it and help guide the surgeon who's operating in a remote village somewhere, guide them into, you know, this and so
tell him exactly
so
what
remotely,
to be done.
yeah, exactly. Tell them what is to be done and tell them, all right, that bowel looks fine, leave it alone, or that needs suturing, stitch that up, and this is what we do. So when we do open surgery, we take stitches like this. But with robotic down, it's just small, fine movements. So there's no tearing, there's no damage, there's less risks to surrounding structures. Like I was saying, nerve sparing, and yeah.
सो बेसिकली आम्ही हाचो भविष्य जेन्ना पळयता म्हणजे फ्युचर ऑफ रोबोटिक्स एक म्हत्वाचो विशय तांच्यानी सांगलो आमकां की हे तंत्रज्ञान आतां हळूहळू इतकें वाडटलें की एखादो सर्जन तांचे सारको एग्जांपल समजा ती आतां ऑस्ट्रेलियाक आसा आनी आमचो एक डॉक्टर आसा की गोवा मेडिकल कॉलेजीन आसा जर ताका म्हणजे शी कॅन कॉपरेट म्हणजे कोऑर्डिनेट विथ हिम अँड कॉपरेट विथ हिम सो ती जेन्ना केस ती ऑनलायन घेतलेली ताचे बरोबर तेन्ना ती एक्झॅक्टली सांगतली बाबा ओके हां हो अमको पार्ट आसा तो तूं धर किंवा अमको सोड किंवा हे अमके कुशीक काड आनी अशें कर सो इट इज लायक वर्किंग अंडर सुपरविजन सो जसो आमी टेबलाक ऑपरेट करतना आपूण एक सर्जन सिनियर सर्जन आसता त्या बरोबर एक सेकंड असिस्टंट आसता तो जशें करता त्याच पद्दतीचे असिस्टंट्स आज खंयच्या जगाच्या खंयच्या कोनशाक बसून म्हणजे अमेरिकेन आसून ऑस्ट्रेलियन आसून न्यूयॉर्काक आसूं मुंबय आसूं तो मेन सर्जन आसा तो थंय बसून आमकां हेल्प करूं शकता तो सगळें चित्र पळोवंक शकता तो गायड करूं शकता आनी तो जशें सांगता तशें हो जो टेबलार ऑपरेट करता ते डॉक्टर तो करूं शकता सो इज समथींग नॉवेल हें आज जे तंत्रज्ञान बदललां मेडिकल टेक्नॉलॉजी तें ताचो बरोचसो फायदो येतल्या एक 10 वर्सां म्हाका दिसता नॉट इवन 10 years I think within 5 years it will go worldwide.
Yes. And another advantage is with really great internet, someone is operating here and he has the same hub, the same operating system is say in Bombay. The person in Bombay can actually operate using the same technology, operate on the person who's here, who's sitting in Goa, say for example.
Yeah, that's what. See, तेच ताणें सांगलां की महत्वाचें म्हणजे आमी खंयच्या एक्सपर्ट मनशाचें गायडन्स घेवंक शकता and he become the part of the system.
Yes.
He has become part of the surgery.
Correct.
सो जेन्ना डॉक्टर आमी ह्या विशया कडेन पळयता तेन्ना आनी एक म्हत्वाचो विशय आसा की आज आमी जेन्ना म्हणजे हाव इट हेल्प्स द पेशंट हाचे विशीं उलयताले इफ आय एम नॉट मिस्टेकन म्हणजे आतां फॉर एक्झाम्पल UK एंड ऑल पेशंटाक आज सकाळी ऑपरेट केलो काय इवन सांजचो घरा धाडूं येता किंवा मॅक्झिमम 1 डे सो आज जे आमी ऑपरेशन ओपन करताले ते 7 दीस 8 दीस पेशंट हॉस्पिटलान रावतालो ते रावनासतना आज पेशंटाक ऑपरेशन केलें एक तो सांजचो घरा वचूं शकता किंवा फाल्यां घरा वचूं शकता सो दीस ऑल्सो अ बिग रोल टू प्ले बिकॉज इट शोज म्हणजे ताची जी मॉर्बिडिटी आसा ते सगळे कमी जाले सो हाचो इम्पॅक्ट सो बट okay maybe cost factor is there so how the patients accept this in your country what is your acceptance at your country
it's quite high acceptance because patients have looked at after the surgery they have less pain they are back to their routine activities and they want to get back to doing they don't want to be sitting at home you know despite having major surgery they're back on their feet they're doing their routine stuff they go home the same day or the next day which is no one wants to sit in the hospital.
Correct.
And it's not just a stress for the woman but for the whole family as
Absolutely.
well. Yeah,
they feel happy the moment you are back to the home म्हणजे हे खूप महत्वाची गजाल आसा डॉक्टर we were talking something about endometriosis I want to know little about more about endometriosis because it's quite common these days, especially about the younger generation. Plus, it is also one of the important factor for our infertility and all. So, what is endometriosis, if you don't mind?
Yeah. Endometriosis is basically a gynecological condition where the inner lining of the uterus grows outside the uterus. So like how we have a period every month, we bleed out, so what happens, the endometriosis sitting outside the uterus also bleeds. And there's blood collecting there. That causes inflammation, that causes scarring, so that causes pain because there are nerves involved in that. There's inflammatory markers released. So how that impacts a young girl today or a woman is when during that time of the month they have pain, and the pain is so bad they cannot go to school, they cannot go to college, they cannot go to work, they cannot do their routine activities. So it's like 4 or 5 days out of the month they are
Absolutely.
so over a period of time that amounts to a lot of number of days. So with endometriosis the aim is to try and treat it, to get rid of it. So when we know that she might be suffering with endometriosis and we go in to treat it, the aim is to get rid of the whole disease process. Otherwise, removing half the endometriotic deposit, leaving half of it behind is not going to help because there's half still left behind. It's still going to cause symptoms. So the aim is to take as much or all of it out. With 3D technology, which is we find in robotic surgery, we can actually see the depth. We can see how what we see on the surface is like the tip of the iceberg.
Correct.
The endometriosis is actually deep within the tissues, within the tissue planes, and that's what the robotic surgery or the 3D vision actually helps us define more precisely, more accurately. So we can. So treatment is complete. Cure is, complete.
So in such cases of endometriosis, usually at the first line of treatment we give some medications, but if it doesn't work or if it is not helpful, then you can go for surgery. And among surgeries, best option, as you said, will be robotic surgery because you can understand the depth of it.
Yep.
Correct. So Dr. And what is the future of this patient? Like say most of the girls, like they are young girls usually. So what is the management and how they progress further? What is the advantage in as conception and everything is concerned?
Yeah, so once the endometriosis is taken out, the inflammatory process is removed. That reduces so that helps improve fertility. Also, because you are removing only the endometriotic deposit, you are not you're causing less damage to the ovaries, the fallopian tubes, less damage to the structures around it. So many times we find endometriosis sitting on the bowel or the bladder or the ureters. Understanding the planes and getting a better definition helps us preserve these major organs, not just for fertility, but for other reasons as well. You do not want damage to the bladder or damage to the ureter while you're dealing with endometriosis. So there's less damage to these major structures. Obviously, if there is endometriosis involving the bowel and you have to take a section of the bowel out, the improved vision helps us resuture or this with less tearing, less pulling, and better outcomes through that. Yes.
Acha. So basically, endometriosis सारख्या सुद्धा दुयेंसांनी जेन्ना robotic surgery वापरता त्याचो खूप फायदो जाता का because whatever may be extension, wherever it has gone, you can take it out without much damage to the tissue because जशें तुमी सांगले की bowel आसा किंवा आनी जे organ आसा तांकां चड त्रास दिनासतना चड मार लागनासतना you can suture it, you can remove it, so that is one advantage. But one more thing I just saw, because before some time we were talking about fibroid. Fibroid can be of 3 different locations, whether it is in the wall or it is intramural. And in this situation, what is your when you will say that okay, robotic surgery I would prefer in these cases, but not in this, where you will put what into action?
You can, like I said at the beginning, you can use robotic surgeries for every gynecological surgery. The biggest advantage at this point in time is for complex. So when you have multiple fibroid, the whole anatomy is distorted. Everything is pushed, not just the uterus, but the ureter. It'll be pushed in one corner or completely twisted. The bladder might be pulled up behind. There's lots of anatomical distortion where the 3D imaging and being able to maneuver the camera and your instruments, they're all under your control. You don't have to shout at the assistant and say, "Ago, te sarke karna."
You don't do anything.
You don't have to do anything. It's in your control. You can do, and
Whatever
you know
you feel.
exactly what you want to do, where you want to go.
Absolutely.
You know how deep you want to go, how lateral you want to go.
Yep.
So it's a lot better. Yeah. And when you take the fibroids out, there's a big hole, gaping hole. So your
Correct.
suturing also is precise. You don't take extra stitches, you don't take less stitches. It's just a lot better.
So, doctor, one more thing, like when after talking about fibroids, another thing, like we have most of the time now till now we have discussed about younger generation and how robotic surgery can help in this thing. Now I'm going to little elderly people. See, like incontinence of urine, what are different factors you know? So in short, you just tell what is incontinence of urine and how you can manage in the robotic surgery.
Yeah. So urinary incontinence is usually found, yes, in women who have given birth, older women because of poor pelvic flow, things like that. So for that, we can, again, when there's prolapse, the whole pelvic floor is prolapsing down. There's a weakness in it. So when we are doing pelvic organ or pelvic floor repair procedures, we can hitch them up a lot better using 3D vision. So we can do colpopexis, where we attach the vaginal vault or the uterus and the cervix up, which is all prolapsed down. We hitch them up. So it helps again, placement of sutures, placement of the hitching up of the organs. It's a lot easier, better visualized, better outcomes, because the procedure is smoother, less trauma to tissues around. And
सो जेन्ना आमी जाणट्या मनशा विशीं उलयता तांकां जे म्हणजे आंग भायर येता किंवा लघवेचे जे त्रास जातात किंवा अशें म्हणजे परत परत 2-2 मिनटांनी अशी लघवी जाता त्या विशयांनी सुद्दां ही रोबोटिक सर्जरी खूब हेल्पफूल जावं शकता, ताचो फायदो जावं शकता आनी ते बऱ्याच जाणची तांकां म्हणजे इट इज व्हेरी हेल्पफूल फॉर द सर्जन. म्हणजे जशें ताका बरोबर असिस्टंट ताका हें व्हर तें व्हर हें धर सारकें धर अशें सांगपाची गरज ना, बिकॉज एवरीथींग इज अंडर हीज ऑर हर कंट्रोल. बरोबर. डॉक्टर, म्हाका सांगा, जेन्ना वेन यू आर लुकींग लायक country like India or maybe like future of this robotic surgery, what you can see and how you think that this is going to revolutionize the concept what is existing today, because we have got another 4 minutes. Anything else you want to give as a take home message, that also is accepted.
Yep. Now we all know medical technology has advanced over the years. It's advanced so much and it will continue to do so. The place of robotic surgery today, I think the most constraining factor or the biggest issue today is the cost.
Correct.
And because of the cost, there are only very few centers who have or who have opted to go for robotic surgery. But with increasing number of centers or increasing number of places using this, the cost of this equipment, the whole robotics, the hub will become a lot less. Therefore, making it more accessible for people all over the world, including in the rural areas. And like I said, the biggest advantage of having this in a rural area is if you don't need super specialist people sitting in rural areas everywhere. They can sit in the big centers and still perform the same complex procedures in rural settings, not necessitating for those women to leave their family behind, leave their and go to a bigger city just to have a procedure done, which can easily be done in their own environment, in their own setting. So that is the biggest advantage for the population or for people in general. Also for the trainees and the surgeons who are going through training now, it's with AI and advanced medical technology, it's easier to teach them. They can do, like for in the aviation industry, there's simulation. They learn to fly the plane in a simulator. In the same case, you learn to do the whole procedure using simulation technology, thereby building your confidence, helping you. And someone can supervise you, not just in your own hospital, but someone overseas can supervise how your surgery, point out what this is. You can record the whole procedure, look for areas of improvement. So the learning curve then becomes smaller, and people gain confidence in doing it. Yeah.
So basically आज हे तंत्रज्ञान इतकें वाढत आसा की हळूहळू हाचो प्रसार खूब जातलो आनी जशें भारत सारकें म्हणजे ल्हान ल्हान गांवांनी सुद्दां म्हणजे ल्हान ल्हान शहरांनी जरी सुद्दां आज ही फेसिलिटी उपलब्ध ना, तरी पण सादो सर्जन सुद्दां जर म्हणजे सादो गायनेकोलॉजिस्ट थंय बसून सुद्दां ते जेन्ना ऑपरेट करतलो जेन्ना ताका ही विल बी सुपरवायज बाय अ एक्सपर्ट. हाचे अशें आसलें की एखादो मनीस जशें सुरवातीक लंडनाक आसूं, तो ऑस्ट्रेलियाक आसूं, मुंबय आसूं, तो थंयच्यान ते सगळें ताका एडजस्ट करूं शकतलो. ताचो एडवांटेज हो जातलो की पेशंटाक थंय मुंबय वचचें पडचें ना किंवा ताका ऑस्ट्रेलियाक वचचें पडचें ना, पण ताचो एक्सपर्ट जो आसा तो ताका फूल पद्दतीन मॅनेज करतलो. आनी ह्या पद्दतीन जेन्ना आमी पळयता तेन्ना आय एम रियली ऑप्टिमिस्टीक. म्हाका दिसता हाचे विशीं आमचे मनीस भलायकी मंत्री म्हटलां की हे तंत्रगिन्यान थोड्या दिसांनी गोंयांनी येवपाचें आसा, म्हणजे गोवा मेडिकल कॉलेजीन येवपाचें आसा. त्या खातीर आमी खूब आशावादी आसा, खूब ऑप्टिमिस्ट आसा आनी तांचो जो एक फुडाराचो पळोवपाचो जो दृश्टिकोन आसा, एक विजन जें आसा ताचे खरेंच आमी तोखणाय करता आनी खूब आमी कौतुकान पळयता की आज अशे वेगळ्यो स्किमी आसा DDSY सारक्यो किंवा आनी बऱ्योचश्यो कितक्यो की जाचो फायदो चडशा लोकांक जाला. आनी ही स्कीम म्हणजे काय अशें की गोंयान अशें खंयचेच कडेन ना. इवन वी आर गिविंग इनफर्टिलिटी ट्रीटमेंट ऑलमोस्ट फ्री ऑफ कॉस्ट, ऑलमोस्ट नो फ्री ऑफ कॉस्ट, which no other state is giving. So here, on this background, I think we are really doing good job in Goa. So doctor, I am also equally optimistic that one day when you will feel or you will find time, you can come and train our doctors. आमच्या डॉक्टरांक ट्रेनिंग दिवंक शकतले, जशें तुमी सांगले सिम्युलेशनान तुमकां लॉट ऑफ थिंग्स कॅन बी डन. आनी हाचो फायदो गोंयच्या मनशा खातीर, गोंयचें तंत्रगिन्यान आनी गोंयची टॅक्नॉलॉजी आनी गोंयचो सरकारी सपोर्ट हे सगळे जेन्ना आमी हातान हात घालून काम करतले, एक सगळ्यांचे जिणेचो एक नवो आयाम मेळटलो, एक नवें सुंदर जिवीत आमकां सगळ्याच गोंयकारांक मेळटलें. म्हाका दिसता डॉक्टर, बिफोर यू वायंड अप, एनीथींग यू वूड लायक टू टेल अवर व्ह्युअर्स एज अ टेक होम मेसेज ऑन एनी सब्जेक्ट रिलेटेड टू गायनेकोलॉजी?
Yeah, thank you for inviting me. But yes, I would be more than happy to come back and help this, because this is where my roots are. This is what, and looking at the advances made and where GMC is headed, I think Goa has a really bright future. There is nothing that you cannot get here that you cannot get elsewhere. So yes, I'm proud to say I'm a Goan.
थँक्यू डॉक्टर. खूब बरें दिसलें की ऑस्ट्रेलिया सारख्या एका येद्या व्हडल्या देशान एका व्हडल्या पदाचेर आसा तुमी, खूब बरें काम करतात आनी आमकां खूब अभिमान दिसता की गोंयचे मनीस, आमच्या कॉलेजीन शिकिल्ले भुरगे आज एका व्हडल्या पदार पावला. वी आर प्राऊड ऑफ यू. आनी असोच तुमचो ह्या विशया कडेन आशिल्लो संबंध, तुमचें एक्सपर्टायज वाडचें, ताचो फायदो जेन्ना तुमी केन्ना तरी आनी सिनियर म्हणून गोंयांत येतली, ताचो तेन्ना लोकांक जावचो. एका आशावादी दृश्टिकोनांतल्यान पळयतना आयची कार्यावळ सोंपयतना तुमी मुजरत वेळ काडून आमच्या स्टुडियोन आयली, ह्या खातीर तुमकां सगळे जे आमचे हॅलो दोतोर पळोवपी लोक आसात किंवा आमची जी ही कोऑर्डिनेटींग टीम आसा तांचे वतीन काळजान सोन देव बरें करून नमस्कार.
Yeah, thank you.
मॅडम, सुगंध तर इतलो बरो येता जाणा.
थँक्यू.
टिफिना वांगडा त्यो न्यूट्रिशनाच्यो गुळयो दिवपाक विसरूं नाका हा.
आता तू न्यूट्रिशनाच्यो गुळयो विसर.
कित्याक?
का या तांदळातूच सगळे न्यूट्रिशन मेळटले. पंचामृता फोर्टिफाईड राईस, हातूंत आयर्न, झिंक, फॉलिक ऍसिड, व्हिटॅमिन ए, बी सारकेले 9 मिनरल्स आसात. तर हे झाले नाही निरोगी आणि सुवादीक? तर पुराय पौष्टिक आहारा खातीर
पंचामृता फोर्टिफाईड राईस
असल्यास पुरो.
पुराय पोषणा खातीर पंचामृता फोर्टिफाईड राईस. घराघरांनी पंचामृता.